Hey guys, so I'm just going to do a quick overview of my methods for our research class. The first, the reason I'm doing this is that we're looking at, me, Megan, and Chrissy are all looking at different factors that may influence function in individuals with chronic ankle instability. Personally, I am looking at muscle strength, at the ankle, knee, and hip, and their effect on functional exercises such as the landing error scoring system, the single leg landing error scoring system, the triple hop for distance, and the figure of 8 hop. We're going to use a uh, cross-sectional cohort study design and use pairwise comparison to correlate each direction of movement that we perform and each functional test, so the landing error scoring system, the single leg landing error scoring system, triple hop for distance, and the figure of 8 hop. Our variables our independent variables are groups, which have two levels, a chronic ankle instability group and a healthy group. And then our dependent variables are the different methods of strength. So at the ankle, we have inversion, eversion, uh, and dorsiflexion, as well as dorsiflexion and eversion simultaneously, and plantar flexion and eversion simultaneously. We chose those because those are generally, the everters are really where you're going to lose your strength when you suffer an ankle sprain. You'll lose it with some dorsiflexion, and and inversion is the mechanism of a lateral ankle sprain. So the plantar flexion really isn't usually influenced. So we decided not to use that. And then uh, in terms of function, our independent variables are the tests that we're using. So the landing error scoring system, the single leg landing error scoring system, triple hop for distance, and the figure of 8 hop test. We're going to counterbalance our participants based on on their group. We're going to counterbalance them with the different tasks at hand. So we're each going to have our own, I guess I'll say, day. That will be, when the participant comes in, it'll be randomized what day they start with. They'll always start with the pros and an informed consent, but maybe the first day they'll do strength, the next day they'll do function, or the next time they come in, at least 24 hours later, they'll do function, and then 24 hours after that, maybe they'll do sensory. And the order of those days are randomized, but they're always going to do the patient-reported outcomes and the consent first. The sensory neurological stuff is a part of Megan's project, and the patient-reported outcomes are a part of Chrissy's project, so I'm not going to get into that. There'll be 3 test days spread out over two weeks. Subject has 2 weeks to complete it, and there'll be at least 24 hours between each testing day. Strength is going to be measured in each direction using a handheld dynamometer. So they're not going through the range of motion. It's an isometric strength measurement, and they're just pressing against the dynamometer, which will give us a reading on how hard they were able to push. And that's the reading that we're going to use. And we'll do best of 3 trials for both legs on the healthy subjects, on the chronic ankle instability side for the chronic ankle instability individual. In order for participants to be eligible for our study, they have to be at least between 18 and 60 years old and score at least a 24 on the Godin leisure time exercise questionnaire. And then inclusion criteria for specifically the chronic ankle instability group would be you score at least a 5 on the ankle instability index, a 14 on the Cumberland ankle instability tool. You need to score, or you can't have a history, you have to have a history of chronic ankle instability, so at least 1 ankle sprain, and your ankle giving way at least 3 times in the past 3 months. And yeah, and then to be ruled out, excluded, the subjects can't have any sort of lower extremity surgery, any lower extremity fracture needing realignment, a lower extremity injury resulting in time lost in the past 3 months, and a ankle sprain resulting in time loss in the past 6 weeks, nor can they have any sort of sensory neurological deficit. And in terms of instrumentation, like I said earlier, we decided on a handheld dynamometer as opposed to a biodex, because a handheld dynamometer is a lot faster to change between directions, and because I believe I have about because I have about 8 different directions that are performing 3 times each on each leg. In some cases, it would be way too time intensive to use the biodex, which is technically the gold standard. So the handheld dynamometer has been studied to be reliable and valid, although it's not the gold standard. So that's my methods in a nutshell. I wish I had more time to really explain it, but I hope that gave you a better idea of what my plan is for text. Thanks for watching, and enjoy the rest of your day.